On Power Talk today, an interesting conversation about the state of our health. Probably one we haven't heard on Power Talk before, but so important. So pleased today to be hosting the CEO of the Aga Khan University Hospital, Rashid Khalani. Thank you so much for making time for us.
Thanks for having me.
Listen, Rashid, if there's anybody who understands our health, it would be you.
Sure.
Among many others. But you would understand, what is the state of Kenyans' health today?
Okay. Let me start with the positives. I think we as a country, we have come a long way and in improving the healthcare, offering an access for the Kenyans. And in the recently published Kenya Demographic Health Survey, and I want to throw some stats at you. To begin with the positive, to demonstrate that we are improving as a country. So, just to give you a few stats, 80% of our children are fully vaccinated as compared to 57% 20 years back. So from 57 to 80%, that's a significant improvement. Are we there yet at 100%? No. So there is room for improvement, but we have significantly improved. 89% of the deliveries are being done by skilled work. So that is, again, and it was 41% 20 years back. So it has more than doubled. It is not 100%, but it's very close to that. 98% of our women receive antenatal care by a skilled provider, which is fantastic. 26% of the females and 27% of our males now have health insurance, predominantly NHIF, but health insurance is picking up in the country. So these are positive indicators for our country. Now let's go to the flip side as well. Africa and Kenya were known for communicable diseases, the malaria, the TB, HIV. But what we have seen now, and what we are seeing now, the burden for the non-communicable diseases is increasing. And according to the same survey, 39% of the deaths in the country is because of the NCDs, the non-communicable diseases. Let me ask you a question. When was the last time you got sugar test done for yourself?
Never actually.
So now that's what I am talking about, that we are not in preventive care. Now let me throw some stats on the negative side of that as well. So according to the same survey, for the women and men between the ages of 20 and 49, 45% of the women and 19% of the men are obese or overweight. 20% of the women within the age of 45 and 49, and 10% of men within the same age has high blood pressure. 4% of the women and 3% of men have been diagnosed with depression or anxiety. So what does this tell you? And many of these NCDs, they don't present any symptoms. Hypertension doesn't present any symptom. So you have to catch it in advance. So this is the data from the KDHS. We, as you said in your introductory remark, we see 700,000 patients every year within the hospital and our outreach centers. We do regular surveys as well. And just in the month of May, we screened 1,200 patients who accompanied our patients. They were not the patients who accompanied our patients. 1,200. And the results were revealing. 28% of those 1,200 had abnormal blood pressure. And 70% of those 1,200 had abnormal BMI, body mass index. So what does that tell you? That now the focus should be on the NCDs. We have to invest on the preventive care rather than being curative care, right? I think in the baseline, when we talk about the maternal and child health, the vaccination, I think we have done fabulously well. It's not done yet. Life is not a picture. It's a movie. It continues. You have to do the same thing, right thing over and over again. But now the focus has shifted and should shift towards the NCDs as well.
So, wow, some sobering statistics, but particularly what you say about preventive rather than curative. Do we then seek out these? I mean, don't use me as the yardstick, dear Kenyans. Get your vitals checked. But so what does that tell us about whether we are checking ourselves and why that is important? You know, now that you're able to survey those who are not even coming in for treatment, how important is that then?
So it is extremely important, and I think that's the sad part, that if Kenyans have curative behavior rather than preventive behavior, many of these NCDs, when we talk about cardiovascular diseases, when we talk about cancer, when we talk about diabetes, these can be prevented if they are detected early. But because we are not going for prevention, because we are not getting ourselves tested regularly, what ends up happening? They are diagnosed at a later stage. So the treatment becomes prolonged and it becomes expensive, right? It puts pressure on the healthcare system. It puts pressure on the insurance and the financial system, and it puts pressures on the individual and the family the most, right? So, but if we are to do more preventive wellness checks annually, then we will hopefully be able to prevent many of these diseases. As I showed you in the stats, that some of these diseases can be prevented if they are diagnosed early.
Yeah, that's important. Let's talk a little bit about your journey at the Aga Khan University Hospital. It's been slightly over 2 years since you became CEO, but you have been within the organization for some time in different capacities. Tell us about your journey.
So it has been a challenging journey, at the same time rewarding. So I took over in March 2021, and if you go back in time, you would remember that that was the third wave of COVID, and the most difficult one. So that's when I took over. So that was a challenging part. And then during the same time, we were going for the CCPC accreditation, which is a Joint Commission Center of Excellence certification for our acute stroke program. And that was coming in July 2021. So that was the time I took over as a CEO. But I think we as an institution, we have performed well because of many reasons, but two comes to mind. First is the 65-year-old history. I think we are not a new institution. We started in 1958, just before, a few years before independence. So we have the heritage, we have the legacy, we have the strong foundations on which any institution can stand on. And the second important thing is the people. The organizations are made up of not buildings, but human resources. The quality of the human resources dictate your today and your future. Within the Aga Khan University Hospital, I am proud to say that the clinicians working there, the allied health professionals working there, the nurses working there, and the support staff, everyone, we have superstars, to say the least, working for the institution. And that has made my journey and my working easier. That does not mean challenges are not there. COVID was one of them. Economic depression is another one. The supply chain challenges that the world is facing is another one. Sometimes dirty competition is there. So challenges are part of life. Struggle is the part of life. But I think if you have the foundations correct, if your principles are right, and you have the right people, then I think the journey is easier.
Yeah, and you know, you've talked about the staff. Aga Khan University Hospital is the only private teaching hospital, university hospital
that is
in
correct.
Kenya. Talk to us about, you know, the model of operation for your organization.
Before I come to the university hospital, allow me just to take back to 1958. This hospital started as a primary care hospital, Aga Khan Hospital. It was more of a maternal care. But over a period of time, we have graduated from primary care to secondary care. And in 2003, 2004, His Highness the Aga Khan, he decided that the hospital in Nairobi should not just be a hospital. He put a U in our name, and we became Aga Khan University Hospital. Now, so yes, you are right that we are the only private hospital which is a teaching hospital. So what does that mean? That we are not only treating the patients, which is more of an episode. A patient comes in, you treat, and they go away. That's episode. We are training the doctors and the nurses for tomorrow. Now that is talking about the sustainability. So that is our model. Now when we talk about the university part, we have the medical college. We have had the residency program, the master's program for the past 16, 17 years. This year, September, God willing, we will be starting the undergraduate MBCHB program as well. The applications are closed now. We have many applicants, so 70 of the medicine will be starting in September. And we have also now very recently started fellowship programs as well. What is fellowship programs? It's the advanced training for the doctors. You would know, and many of us in Kenya would know, that the advanced training, people used to go outside, go to Canada, go to US, go to UK or South Africa for advanced training. And what we saw that many people who go to Canada and US, after their advanced training, because we are so good as Kenyans, they would tend to stay back. Right? So now we are trying to lock them in. So we are providing many of these advanced training programs within Kenya as well. So we have already started 8 such programs in cardiology, in medical oncology, in hematology, neonatology, and neurology, and the list goes on, and the list will continue to grow. Because what we are trying to do is to provide the same good quality training, international standard, here in Kenya. Okay. So people don't have to go outside. First we have to stop people from going outside to get care. Now we have to stop people outside to go for education programs as well. But it has to be of good quality education. And you have to have the right patient mix to provide good quality care as well. And thankfully we have that patient mix and patient numbers, volume as well.
Yeah. So treating 700,000 patients a year and managing the staff and the courses that you are putting in place, that must keep you up at night.
What keeps me up at night?
Yeah, that must, in and of itself. Yeah.
Besides my weight, I have become very conscious looking at this data. So now I have my watch. I think I have to improve as well, like many others. So that's one part. But jokes aside, I think there are two things which are very close and dear to my heart. First is the quality. We were the first hospital in Kenya to get the Joint Commission accreditation from United States, which is a gold standard for hospitals. Government didn't ask us. Many people don't understand it. There are 1,300 standards, and it's an expensive audit. It's time-consuming, but it's the right thing to do when it comes to patient care. So what keeps me awake at night is to ensure that the quality is sustainable, right? We walk the talk. That does not mean that we are perfect. We are human beings. Doctors are human beings. They will make mistakes. But do we learn from those mistakes? Do we improve our processes on a continuous basis? So that's part one. Because patient, whatever we do, patient has to be at the center of everything, right? So that's one part. And the second part, like you said, we have 3,300 people working for us. So those are 3,300 families. If you multiply it by 4 or 5, you're talking about 15,000, 16,000 people. And their livelihoods are dependent on us as well, right? So we have to provide good quality service, so which we can ensure financial sustainability, so we can employ and sustain those employees. And they should have good quality of life for themselves, for their families as well. So these are the two most important things for me as the CEO.
And that's a good place to leave it. Understanding that, we wish you all the very best as you continue with that. It's been such a pleasure hosting you and for challenging us with our health in terms of what we need to keep top of mind.
Sure.
Prevention, better than cure.
Definitely.
As always. Thank you very much. Rashid Khalani, the CEO of the Aga Khan University Hospital, joining us on Power Talk.